Assalamu alaikum ji. I'm Amna Khavar and I am Manager Training Center for Professional Excellence Department, University of Central Punjab. Welcome to Center for Professional Excellence Talks. UCP Center for Professional Excellence has been established with the scope to train and upskill the individual professionals and support in the capacity building of the organizations in both public and private sectors in line with the modern technology and professional standards. We help all type of organizations and individual professionals to achieve and sustain organizational and operational excellence through collaboration with our national and international partners. Our team consists of the subject matter experts possessing international experience and exposure and extensively involved in the international standardization and professional education pertaining to business innovation, excellence, and technology in multidisciplines and industries. Today, we have invited Dr. Zahida, who is a public health professional, and she is going to join us today in our program. So we welcome you, Dr. Zahida.
Thank you very much, Amna.
Dr. Zahida, we would like you to please introduce yourself.
First of all, once again, thank you very much for giving me this opportunity to talk about something about me and then about our diploma programs. So as you already have mentioned, my name is Dr. Syeda Sarwar. I'm a public health professional. I would very briefly give you a brief introduction. I have actually started off my career as women medical officer from a rural health center. And in that era, you know, everybody was inclined towards post-graduation in gynae and ops, or in other some specialities. But I got a chance to do my public health from University of Leeds, UK. I went there on a scholarship. I did my MPH, and then I changed my mind. I inclined towards public health, and since then it was way back in 1998, and since then I have been working in different capacity in both public and private sector as public health manager. Currently I have been working as a project director in a polio eradication initiative, and at the same time, you know, that we have been working for this diploma programs and short certificate programs in University of Central Punjab. Okay, so this is all about me.
Thank you, Dr. Zahida, for such a brief introduction of yours. So today, as being a public health specialist, we would like to ask you that why is public health on priority?
It's a very pertinent question. As I have already mentioned, when you are a clinician, you focus on individuals. And when you are a public health manager, your scope is much broader than being a clinician. Public health is actually a science of preventing disease and promoting healthy lifestyle. It actually protects individuals and promotes healthy lifestyle, and resultantly there is a maximum level of health and well-being of the community. So through public health, we can develop policies, we can develop strategies, we can implement them, we can evaluate them, we can regulate health system. So in comparison to that, my interest was in public health, and public health has a greater scope. That's why I think that public health is the most important, especially in this era. It is most important, and we need to focus on it.
Very true, Dr. Zahida. Bada acha aapne detail mein bataya. Please tell me that which particular certificate and diploma programs are you going to offer in the coming days under the umbrella of public health? जैसे कि आपने बताया कि ये बहुत important है, and you know आजकल इसकी need है. इसके अंदर वो तमाम diploma और certificate programs जो कि dire need है लोगों की, उनके सिलसिले में आप थोड़ा सा brief करें.
बहुत शुक्रिया Amna. There is a long list of diploma programs which will be offered through this platform. For example, diploma in hospital management, diploma in prevention and control of infectious diseases, diploma in reproductive health, in child health, in nutrition, in digital health. So there's a long list. But at the moment, from January onwards, we will be offering diploma in hospital management and diploma in prevention and control of infectious diseases.
Yeah. So as you have mentioned that 2 courses are going to be offered from January onwards. So I would like to ask you regarding the hospital management professional diploma program that after offering these programs, do these public health courses, trainings, and it will help the hospital managers in managing their hospital affairs?
Definitely, of course, Amna. Because at the moment, if we, being very honest and transparent, we know that most of the hospital managers lack the basic understanding, basic knowledge and competencies to handle any adverse situation which we are coming across day by day in hospitals. And in addition to that, if a public health manager, if a hospital manager knows about the basic concepts of public health, if he or she knows what is the essential package of health services to be delivered through that level of health facility, and by this I mean that essential package of health services will vary from hospital to hospital. Yeah. For example, EPHS for a Tehsil level hospital will be different from a DHQ level hospital or a teaching hospital. So when I know this is the essential package of health services which I need to deliver through my hospital, then I will need to know what are the minimum service delivery standards which are required for the delivery of this package of health services. And accordingly, Amna, I would need to know that what are the HR requirement, HR deployment kaise honi hai, how to manage HR, my existing HR, and how to deploy more HR, then what are the equipments, medicine, logistics, commodities which are required for the delivery of healthcare services. I need to know the importance of data, because data is wealth. Data is actually an asset, and we can use data for planning, for decision making, and I can promote evidence-based decision making. I would also learn to know that how to set my targets for my hospital according to my catchment area population. So keeping in view all these factors, I think agar ek hospital manager ko public health ka or diploma in hospital management ki opportunity milegi, he or she will perform better, or quality of care services will be improved a lot.
Exactly, very true. Because these are the basic things which one should know while working in the hospitals, and every different kind of a hospital needs different kind of understandings कि उसके basics क्या हैं जिसके ऊपर आपने लेके उसको चलना है, and it will definitely give you a better result. So okay, my next question is that since the world has turned into the global village, Dr. Zahida, so what do you think? Yes. How does the infection prevention, control, and management will help in dealing with the emerging epidemics and pandemics of new diseases?
Amna, बहुत pertinent question hai. Need of the hour कि we need to focus on prevention and control of infectious diseases, and over the past 2 decades there has been a significant increase in infectious diseases. और एक हमारे सामने है COVID-19 की pandemic, और most of the resources of the world were shifted towards preventing and treating patients suffering from COVID-19. और हमारा एक ही focus था to limit the impact of COVID-19 pandemic. So keeping in view the most latest pandemic which we are coming across, और ये पूरा दुनिया में हो रहा है, इसके साथ साथ हमारा ये course जो है, it will focus on almost 20 infectious diseases, जिसमें typhoid भी होगा, TB होगा, hepatitis होगा, Ebola होगा, Zika virus, इस तरह की, so on and so forth. लेकिन इसमें important thing is that being public health manager, we need to know कि actually disease को हमने identify कैसे करना है. We need to learn the case definition. What do we mean by suspect? What do we mean by probable case, and what is the confirmed case? फिर उसका positive agent क्या है? What is the mode of spread? उसका incubation period क्या है? Communicability period क्या है? तो ये सारी चीजें, और इसके साथ साथ how to prevent this epidemic and how to control this epidemic. हमें environmental health hazard, how to control patient, how to control contact, और फिर environment का हमें control कैसे करना है. And at the same time, one thing is most important thing is how to report this disease. क्योंकि देखें, जब तक आप reporting पे नहीं focus करेंगे, आप इसको control नहीं कर सकेंगे pandemic को. through these programs, I think we will be able to transfer this knowledge to public health managers, ताकि वो अपने जहाँ वो हों, they can perform better.
So, डॉक्टर ज़ाहिदा, जैसे कि अभी आप रिसेंटली 2 प्रोग्राम्स आप लोग कोर्सेज ऑफर करने जा रहे हैं, प्रोफेशनल डिप्लोमा प्रोग्राम्स, हॉस्पिटल मैनेजमेंट और ये कंट्रोल एंड मैनेजमेंट ऑफ इन्फेक्शियस डिजीजेस, इसके अंदर आप क्या समझती हैं, व्हाट आर द मिनिमम एलिजिबिलिटी क्राइटेरिया फॉर अप्लाइंग इन दीज कोर्सेज ऑफ पब्लिक हेल्थ?
इसमें देखिए MBBS डॉक्टर्स, डेंटिस्ट, फार्मासिस्ट, फिजियोथेरेपिस्ट, any person having a bachelor degree in social sciences and with an experience of working in health department, उसकी कोई मतलब एक्सपीरियंस भी है, उसका शौक भी है, जज्बा भी है, दे कैन अप्लाई. लेकिन उसके लिए हमारा एलिजिबिलिटी क्राइटेरिया में मतलब सिलेक्शन में एक एंट्री टेस्ट भी होगा एंड एक इंटरव्यू भी होगा. बेस्ड ऑन दैट अगर वो फुलफिल कर लेगा वो तमाम क्राइटेरिया, तो वो दे विल बी एलिजिबल टू एंटर इनटू दीज कोर्सेज.
राइट, सो ये इनके प्रोफेशनल ग्रूमिंग में हेल्प आउट करेंगे ये सारे डिप्लोमा कोर्सेज एंड सर्टिफिकेट्स. डेफिनेटली दे विल हेल्प.
डेफिनेटली, हाँ, एग्जैक्टली. क्योंकि देखिए प्रोफेशनल ग्रोथ के लिए बड़ा जरूरी है कि हम ऑनगोइंग मेडिकल एजुकेशन एंड ऑनगोइंग कैपेसिटी बिल्डिंग हमेशा रहनी चाहिए. और थोड़ा सा सेंसिटिव है, बट वी नो दैट मोस्ट ऑफ द पीपल्स आर प्लेस्ड ऑन पोजीशन बाय वर्च्यू ऑफ देयर एक्सपीरियंस, बट नॉट बाय वर्च्यू ऑफ देयर क्वालिफिकेशन. मैं आहिस्ता आहिस्ता गवर्नमेंट सेक्टर में अगर हूँ तो मैं ग्रेजुअली एक पोजीशन पे पहुंच ही जाऊंगी, बट इट इज इम्पोर्टेंट कि जी मुझे आई टोटली एग्री दैट experience has no match, but in parallel अगर experience के साथ साथ मेरी knowledge और मेरी qualification और मेरी मतलब जो skill set है, मेरी understanding भी अगर improve हो जाए public health के concept पे, तो ये एक additional एक एडेड बेनिफिट होगा.
बिल्कुल सही, बिल्कुल सही. सो अब ये जो इतने भी ट्रेनिंग प्रोग्राम्स हैं या डिप्लोमा प्रोग्राम्स हैं, ये आप लोग वीकेंड्स पे ऑफर करेंगे या वीकडेज में?
ये जो डिप्लोमा प्रोग्राम्स हैं ये वीकेंड पे हैं हमारे. सैटरडे संडे को 3 आवर्स, एवरी सैटरडे एंड संडे 3 आवर्स का लेक्चर है. 6 मंथ्स कोर्स है फॉलोड बाय 3 मंथ्स रिसर्च ना, जिसमें जाहिर है फिर आपका एक रिटन एग्जामिनेशन होगा, फिर आपका वाइवा होगा बेस्ड ऑन दैट डिसर्टेशन. राइट, सो 9 मंथ्स कोर्स बेसिकली.
अच्छा, सो एक इनमें से हॉस्पिटल मैनेजमेंट जो है दैट इज अ 9 मंथ कोर्स और इन्फेक्शियस डिजीज वाला जो है 6 मंथ कोर्स. Is it so? Right. So अच्छा, अभी आप क्या सजेस्ट करती हैं कि जो ये ट्रेनिंग और डिप्लोमा प्रोग्राम्स हैं वो सबसे ज्यादा रिक्वायरमेंट उनकी किन को है, पब्लिक सेक्टर वालों को या प्राइवेट सेक्टर एम्प्लॉइज को?
कीपिंग इन व्यू जो हेल्थ सर्विसेज प्रोवाइड की जा रही है ना, अगर हम डाटा देखें तो 50% ऑफ द हेल्थ केयर सर्विसेज आर बीइंग प्रोवाइडेड बाय प्राइवेट सेक्टर. तकरीबन इक्वल हो गया है. प्रीवियसली इट वाज 40%, कोई 35 to 40% was these services were provided by public sector और बाकी जो था 60% का चंक जो था वो प्राइवेट. अब ऑलमोस्ट इक्वल हो गया है. तो कीपिंग इन व्यू के बोथ पब्लिक एंड प्राइवेट सेक्टर दे आर प्लेइंग देयर रोल इन प्रोविजन ऑफ दीज हेल्थ केयर सर्विसेज. तो आई थिंक बोथ ऑफ देम नीड दीज काइंड ऑफ डिप्लोमा प्रोग्राम एंड ट्रेनिंग प्रोग्राम्स.
राइट, सो थैंक यू डॉक्टर ज़ाहिदा, थैंक यू वेरी मच. आपने इतना डिटेल में, इतना ब्रीफली सारे चीज़ों के बारे में, अपने कोर्सेज और ट्रेनिंग और डिप्लोमा प्रोग्राम्स के बारे में बताया पब्लिक हेल्थ के. वी थैंक यू वेरी मच टू टेक आउट द टाइम एंड टेल आवर ऑडियंस अबाउट इट. थैंक यू वेरी मच डॉक्टर ज़ाहिदा. Thank you very much, viewers.
Thank you very much, Amna.
Thank you very much, viewers, for watching us. We hope कि इससे आपको काफी डिटेल इंफॉर्मेशन रिसीव हुई होगी और हम उम्मीद करते हैं कि आप आने वाले दिनों में अपने आप को इन डिप्लोमा और सर्टिफिकेट कोर्सेज में ज्यादा से ज्यादा अपने आप को एनरोल कराएंगे. शुक्रिया.